Welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board certified veterinary dentist, and we come to you every week on Wednesday to provide the veterinarian and the technician team some actionable things that you can use in your practice. And this episode is going to be a recorded episode that we've done in the past, not a podcast that we've recorded or not the Vet Dental Show, but actually some other information for you that we know you're going to enjoy. So sit back, enjoy, and we'll see you at the end of the podcast.
From Megan, will we combine a simple cyst removal with a dental procedure? In some cases we do. Now, again, we're not a general practice, but we do have sometimes very small skin tags that we may remove because we really don't have instrumentation for doing lumpectomies or cyst removals. But with dentistry, we really try and keep that procedure all by itself. It is never appropriate to give or to do a dental procedure with an abdominal surgery like a spay or an orthopedic surgery where we've got an open joint. All of that stuff should be kept separate, absolutely. And I know a lot of folks like to combine anesthesia and do as much under one anesthetic event as they can. But dentistry is really one of those services that should be isolated all by itself. The only time would be for a small mass removal would be the only time that we would do something else. Alrighty, from Megan, our vet has us do the teeth scaling, then rads, as opposed to rads first. Risks shoving bacteria up into the gums when probing, etc. Okay, so this information, unfortunately, a lot of veterinarians don't get accurate information, and it's secondhand or something that they've heard. There's bacteria subgingival already. That's the reason that we're doing a prophylactic scaling above and below the gum line with the periotip, and then treating those pockets appropriately. And so cleaning first before x-rays and probing really doesn't have any benefit. In order to do these cases efficiently, we need to get the diagnosis first, like we talked about, and get that owner permission, get that estimate made, get that done as quickly as possible so that we can complete that case as needed moving forward. So we will talk about that, how we proceed with a case, and getting that done efficiently. But the diagnosis needs to come first, absolutely. So that tends to be a myth about moving that bacteria subgingivally. It's already there if the pocket's there, and we're going to clean that out when we treat these patients. All right, from Kate, do we do every patient on 2% when beginning? That's typically where we start, yes. That's just a good level that will get them to a plane, a fairly light plane. We don't need to have them on 3. We don't ever have them up on 4 or 5 but for a few breaths if they're jumping off the table. But 2% is typically where we start. And then once we progress to the point where we've completed the assessment, we've got our nerve blocks on board, and oral surgery may be beginning, we start to back that down. Once our nerve blocks are on board, that patient should be fairly comfortable, and even if we start oral surgery, they're not feeling anything, and as long as they're sailing at a nice comfortable plane where they're not moving or jumping off the table, then we can start to back them down. And so a lot of our patients will maintain for the remainder of the procedure at usually 1.5. Sometimes we get them down to 1%. All right. Those patients that we need to give an accurate estimate, And yeah, this can be a challenging challenge, not only in general practice, but sometimes in our referral practice as well. And it really comes down to, number one, education, again, re-educating our dental clientele, as well as setting expectations appropriately. So we do have those clients that will want to know, how much is it, or how much can I expect? And I have pretty much the same conversation. Unfortunately, we won't know for sure until we complete that assessment. So I give them that initial oral diagnostics estimate. We'll quote you for what we know we're going to do. And then once we get those x-rays, we're going to call you. But if we've got a patient in front of us that we know has got some advanced perio in there, we may give them, just a very big ballpark that potentially it could be an additional X amount of dollars, and just historically use your own patient base as kind of a guideline for those advanced perio cases. And that you'll know for sure once you take those x-rays, and that you'll not proceed with anything until talking to them first. And that estimates are done in such a way that I do a verbal over the phone, but I do have the ability to email them the estimate if they need to see it line by line. That's absolutely doable. But again, we want to do it within that 10-minute time frame so that we remind them that their pet's under anesthesia. And certainly I can email you the estimate if you want to take a gander at that. Give me a call back. In the meantime, we'll start cleaning and then go from there. They always have the ability or the option to not proceed, and I always throw that out there. We do not have to do this today. If you need to just see what the assessment is, and then we put the estimate together and then have you come back for the work, we can absolutely do that, and always give them that option. That's certainly not, anything that's not, a deal breaker. Some of these pet parents are of the personality that they're very detail oriented, and they need to process before they can move forward. And honestly, it's not the majority of people. It is, few and far between, but I have had those folks that are like, I'm not ready to do anything today other than the assessment and the cleaning, and let me look at all of this. And then of course we'll show them the x-rays at discharge and explain to them why we made the decisions that we did and why those were on the estimate. So that is just dealing with those clients that are fussy and need a little bit more information in order to make a good decision to move forward. And the less pushy we are, if we back off and give them the option to not do anything today, we can always have you come back. A lot of folks are okay with that, and it kind of eliminates some of that anxiety for these patients or these pet parents. Good question. All of those. Yeah, this is a tough one, Emily. Thanks for bringing this up, because again, this is another tough conversation to have with some of these pet parents, especially those that have gone through a bad experience. And I've had this conversation many times with folks that are coming, from a general practice, or know someone personally, or they've had their pet die under anesthesia. And so I always start the conversation, we do things a little differently in our practice with regards to anesthesia. Our agents are different. We're able to use agents that metabolize quickly, and we're able to keep them very, very light. And then I talk about how we monitor these patients, that all of these parameters are tracked. And I also let them know, and this is a big one, that if we run into any issues at all, that our monitoring tells us we're, approaching trouble, we just wake them up. We don't try and power through. If we can't resolve whatever issue it is quickly, we wake them up. And we let those owners know that, there's nothing in the oral cavity that we can't fix, later. But anesthesia, we are very, very diligent about keeping these patients light, keeping them safe, and that if we run into any trouble at all, because they're monitored very closely, we have the ability to know, be proactive instead of reactive, catch things and make appropriate adjustments if needed, or we'll just wake them up and regroup and have them come back for the work if needed. And that typically makes them, again, relieve some of that anxiety that, we're not going to push through. If we're having an issue, and because we keep them so light, they wake up very, very quickly, and we can get ourselves out of trouble if we go there. So those simple statements, and again, educating the client as to what our protocols are and how we do things differently, and that we're extremely diligent with our patients, because we know that anything in the oral cavity is not going to be fatal. Anesthesia, we are going to prioritize and make sure that we try and keep that anesthesia time as short as possible, and to keep their pet as safe as possible.
I trust you enjoyed that episode. We enjoyed providing it. If you would, do us a big favor and go to our iTunes page, post a rating and review, and take a picture of that with your cell phone, and then post it on our Facebook page, and we'll send you the Instrument Use Essentials course. If you also look below, there is a link to 2 live trainings that we do. And one is on radiographic interpretation. The other is on killer tips for quicker extractions. If you have not been to those, register for the one that's coming up next, and the link will be in the show notes on the website, the Vet Dental Show, and we'll get you in and get you a 30-minute, 40-minute overview of those topics that are really insightful and all take home. And then we'll also give you an opportunity to get a great deal and some bonuses on those 2 courses that are online courses that span 5 hours and 7 hours. So hopefully you enjoyed this episode. Hopefully you'll help us out with the post on our Facebook group. And then as a little extra bonus for you, you've got that link down there. You can register if you haven't been to either one of those and enjoy all of that content that we're going to give you on those 2 topics. So take care. We'll see you next week.